There's an old saying that goes, dead men tell no tales. You can't communicate with the dead. There's no way they can tell you anything about what happened. Or can they? In this video, I'll argue that actually we can talk to the dead and they can talk to us. You just have to know how to listen. So, today, the death investigation. Cause and manner of death. So, say we find a body at a crime scene. We're probably going to ask a series of questions. First of these, how did they die? Were they shot? Did they fall off a ladder and hit their head? Were they poisoned? That's what we call the cause of death. We'll take a look at that today. Why did they die? In other words, what were the circumstances surrounding their death? Was it suicide, homicide? Maybe it was just an accident, or maybe it was just their time. They died of old age. That's what we call the manner of death. And then finally, when did they die? This is what we call the time of death. Today, we're just going to cover the first two questions. How did they die, the cause of death, and why did they die, the manner of the death? Next time, we'll take a look at when did they die, the time of death. Let's get started. So, first question, how did they die? This is what we call the cause of death, and there's a formal definition for this. The cause of death is that which initiates the chain of events leading to death. It's important to keep this in mind, because it might not be totally straightforward what cause of death means without a definition like this. So, for example, let's say you find somebody on the ground and there's a big pool of blood around them. Well, it's clear that what killed them was the blood loss, the lack of blood, failure of the cardiovascular system, no oxygen to the brain, no circulation to the vital organs. That's it. But that's not the cause of death. The cause of death is whatever caused the blood loss. So maybe it was a gunshot wound, for example. In this case, the gunshot wound would be the cause of death, not the blood loss. So it's the thing that started off the chain of events that led to death. So how do we determine the cause of death? Well, there's two main things we want to look at. The first is the investigation of the crime scene. So what can we find from the crime scene? And the second is the internal and external examination of the body, what we call the autopsy. And then as a part of the autopsy, we'll also do toxicological testing, meaning we'll look for the presence of drugs, poisons, things of that kind. So let's take a look at the role of the crime scene investigation in determining the cause of death. We can learn a lot here. First of all, are there weapons at the scene? Is this a person who seems to have died from multiple cuts and there's a bloody knife on the scene of the crime? If so, you may have a sense of what happened here. Is there evidence of destructive forces that have moved through the area where the body was found? Are there limbs missing from trees in the forest where you found the body? Maybe there was a major storm here. You could probably tell that because it's not hard to look at the weather. Maybe the place where you find them is scorched by fire, and so is the body. This suggests, perhaps, that they died in the fire. So there's lots of things we can look at the crime scene. Are there poisonous fumes in the area here that might have poisoned the person? What about poisonous materials? What about drugs, bottles, packets of drugs, things like that? Now, while investigation of the crime scene is certainly useful and required for establishing a cause of death, it's not sufficient. Typically, we also want to examine the body and do a thorough autopsy. So, we might find a pistol at a crime scene and think that, well, there's a pistol here, there's a gunshot wound. Put two and two together, this pistol caused the fatal wound, but maybe not. Maybe this pistol is unrelated. Maybe the victim was trying to defend themselves with this pistol when they were shot. The autopsy might help us figure out the difference between those two possibilities. We find a bottle of pills in somebody's pocket, and they don't have any external injuries. We might think, oh, look, they took too many of these pills, they poisoned themselves, that's what related to the death. But without the autopsy, we can't tell for sure. So we do need to do that detailed investigation. And then if we find this charred body in the midst of a burned out building, did the fire actually kill them? Or maybe they were killed before the fire, and then the fire was set to cover up the murder. The autopsy will again help us to distinguish between these possibilities. So let's take a look at the autopsy, and we'll start with the external exam. Autopsy, by the way, the word roots auto and opsy mean to more or less to look for yourself. So we're really going to lay eyes on the body, every inch of it, inside and out, and see what we can find out through a thorough investigation. Start with the external exam. So we would strip all of the clothes from the body, and we would examine every inch of the body looking for wounds. So gunshot wounds, cuts, bruises, broken bones, things like that. We'd classify them and say, well, this looks like a stab wound, this looks like a gunshot wound, this looks like a blunt force injury, like being struck with a hammer or something like that. And then we'd photograph so that we have a record of all of these wounds for the case later on and to refer back to once we've lost custody of the body and it's been returned to the family. This is also a good time in the case of gunshot wounds to look for gunpowder stippling or tattooing. So the idea is that if a person is shot, what comes out of the, here's my mug gun, this is called a mug shot, do you get it? When the gun is fired, obviously the bullet comes out of the barrel of the gun, but also little bits of very hot gunpowder come out. And if the gun is close enough to the victim when it's fired, some of those little hot bits of gunpowder will also hit them and will cause very small little burns on their skin. We call that gunpowder stippling or gunpowder tattooing. We'll look at a picture of that in just a moment. And if that's present, we actually know something about the distance the gun was at when they were shot. That could be really important. If a person is shot from 30 feet away, then probably they didn't do it to themselves. This was a homicide or an accident. What else do we look for in an external exam? We take x-rays in an external exam. We want to see, are there broken bones that we might not have seen at first? Maybe on the arm, signifying that they were trying to defend themselves from attack. Maybe there is a series of broken bones that have all healed. What would that tell us? Maybe that suggests that this person is involved in a history of abuse. They've been repeatedly beaten in the past, and maybe this time it went too far. So x-rays reveal internal injuries and perhaps provide evidence of long-term abuse. We also want to take samples from the victim. What kind of samples? We'll take samples of their clothing, fingernail scrapings or clippings, mouth swabs, so a little cotton swab in the mouth to take some cells that we can then use for DNA testing later on. If they've been shot and we can recover the bullets, we want to take those bullets. That can give us evidence about what sort of weapon was used to fire them. We also want to take cavity swabs, especially if we suspect a sex-related crime. Okay, so these are swabs of the genitals, the anus, the mouth, and so forth, to test for the DNA, for example, of a possible sexual assailant. In the case where somebody has been killed by a gunshot, we also like to swab the hands and see if we can pick up any residual gunpowder. When the gun is fired, not only does the bullet and the gunpowder come out the barrel, but sometimes some of it will sort of blast backwards onto the hand, and you can actually pick that up. So if a person shot themselves, then we expect gunpowder on their hands, and if they didn't, then it would be consistent. We don't find that gunpowder. So there's the external exam. What about the internal exam? Oh, before we get to there, here's an image of the gunpowder stippling. So you can see it's like multiple very, very small impacts around the central gunshot wound. Shows us that the gun was relatively close to the victim when they were shot. All right, let's take a look at the external examination. So the external examination is where we cut the person open and we really take a thorough look at them. This is the most complete physical you'll ever get. So we do a Y-shaped incision across the chest and then down to the pubic bone. This allows us to open up the chest cavity for examination. We can also cut into the face and skull and remove the skull for examination of the brain. This is the point where we would remove each organ, we would weigh it, we would examine it to see if there was any abnormal shape or structure. We'd also take samples of each organ that we can test in toxicology to see if there are drugs or poisons or anything like that present. And they also provide us a reference for later. Remember, humans don't like their family members to just be, you know, in some locker in the county morgue. People feel a lot better when they can process the dead in whatever way their culture prefers. So whether that's incinerating the body through the process of cremation, putting it underground, the process of burial, preserving it partly through embalming and then putting it underground, scattering the ashes out at sea, whatever it might be, people tend to like to do those things. And eventually you're going to have to return the body to the family. Once you've done that and it's been embalmed or buried or even incinerated, your access to the body is going to be significantly reduced. It's going to be hard for you to do any further testing, so having those samples on hand can be really helpful. It's not beyond recovery if you've given the body back. You can exhume a body that's been buried. Even if it's been embalmed, you can still do a lot of testing. You might even be able to do some tests on the cremated ashes of a person. That said, it's nice to have these samples from the body before you return it to the family. So what can we find from looking at the organs? Well, we might find, for example, evidence of chronic drug use. So is this a person who's been chronically using heroin, for example? You can see evidence of that in the heart. Or chronic alcoholism becomes very apparent by examination of the liver. We also might find underlying medical conditions. So perhaps this person has a congestive heart failure because the arteries that provide blood to the heart muscle have been obstructed by plaques and fatty deposits and so forth. That might be really important information for your case. So we've got these reference samples now of all the tissues, fluids, organs, and so forth. We've got those if we need them for later. This is also the time when we would assess the stomach contents. You can use this for multiple things. Sometimes investigators will look at the state of digestion, and they'll be able to sort of deduce something about how long it was since they ate, if they know the time of death. That's not sort of the most reliable thing, but you can deduce some things. So if a person has a full stomach of food, then probably they were killed, within an hour or two of eating. Because if they had been killed later than that, then presumably that food would have left the stomach and gone further down through the digestive tract. You can also see whether there are pills in the stomach. So if there's somebody who has a prescription medicine and there's 50 of their pills in their stomach, then maybe they took these pills with the intent to take their own life. So stomach contents can be very useful. We also would do routine toxicology testing for common recreational drugs. So these are opiates, like heroin, pills, prescription drugs like Vicodin, morphine, fentanyl, oxycodone, things like that. Benzodiazepine drugs like Xanax, Klonopin, Valium, barbiturate drugs like those that are used for anesthesia, marijuana, cocaine, methamphetamine. These would be some of the common recreational drugs we test for. You probably wouldn't see routine testing for something like LSD because it's such a rarely used drug. But if the circumstances in which you found the body suggested that some particular test were necessary, then you could always order the additional test. So for example, while you wouldn't normally test for carbon monoxide poisoning, if you found somebody dead at the scene of a fire, you might do that. Or if you a common sign of carbon monoxide poisoning is that the skin turns a really bright red. The combination of the carbon monoxide with the hemoglobin in the blood makes a really, really bright red pigment called carboxyhemoglobin. And if you were to see that in the body, then perhaps you'd order carbon monoxide testing to confirm that this is actually what killed them. So there's toxicology tests that are routine, and then there are toxicology tests which are ordered when there's suspicion of poisoning or some unusual drug being used or something like that. All right, so here's your Y-shaped incision down through the chest and then down through the sternum, down all the way to the pubic bone. Usually then a cut is made through the ribs, and the whole rib plate, the front plate of ribs, can be entirely removed for easy access to the thoracic cavity where the heart and lungs are. And then all you need to do really is open up a few layers of tissue to get access to the abdominal cavity where the digestive system is. And then there are a few other cavities and membranes you have to open to get access to all the organs. But that's the idea here. We want full access to all the organs: heart, liver, lungs, digestive tract, kidneys, lymph nodes, things like that, so we can examine them. Okay, so we've done all this work. We've done a thorough criminal examination of the crime scene. We've done a thorough autopsy inside and out. What are the sorts of causes of death that we can label this person with? Blunt force trauma. So this is death because you've been struck with some blunt, meaning not sharp, object enough to cause death. So maybe a tree fell on you. It crushed your torso. That would be blunt force trauma. Maybe somebody went to town on your skull with a baseball bat. Blunt force trauma. Maybe you were hit by a car. Blunt force trauma. That's in contrast to sharp force trauma, which is being stabbed, being cut, being impaled on a sharp fence post, for example. All of that would be sharp force trauma. Gunshot wounds. Pretty self-explanatory. You have a wound that was caused by a bullet fired from a gun. Gunshot wound. Asphyxia means anything that's interfering with the intake of oxygen into the body and the oxygenation of the brain. So this is if a person was being choked. Hanging is usually death by asphyxia. Some people assume that all hangings kill through snapping the neck violently, but that's actually not true. Most hangings are result in death by asphyxia. It's only really when you have sort of a professional executioner who ties the knot just right and gets the height calibrated and all that, that you can reliably snap the neck. And even then, it doesn't always work, and sometimes they use a little too much force. And there are actually historical cases of hangings not that long ago, like within the last 50 years, where people were hanged and the drop distance was miscalculated, and they were actually decapitated. So pretty gruesome stuff. So asphyxiation, again, death due to lack of oxygen. Substance abuse is a cause of death. So a heroin overdose, for example, or an alcohol overdose, alcohol poisoning leading to death. So substance abuse can be a cause of death. So there are your causes of death. That answers the question of how did they die? Now we're trying to answer the question, why did they die? And this is what we call the manner of death. So the manner of death is defined as the circumstances that led to the fatal result. So let's just talk through the different manners of death that a medical examiner would use to classify a death. So the first is homicide. Homicide is defined as the non-accidental death resulting from grossly negligent, reckless, or intentional actions of another person. So let's work through that a little bit. Intentional, that's fairly straightforward. This means I want you not to be alive anymore, or I want to hurt you very badly, so I hit you repeatedly with a baseball bat in the head. Okay, I'm trying to kill you. It's an intentional action, clearly homicide. But it doesn't have to be intentional. I can kill you accidentally, and it can still be homicide. So for example, if I'm driving drunk down the road, and I'm swerving all over the place, and I run into you, I could be charged with homicide. Of course I didn't mean to kill you, but I was totally reckless in driving while severely intoxicated, and so I could be charged with homicide, vehicular homicide there, because of my negligence, or my recklessness. Negligence as well. Maybe you have a small child and you've got a room full of chemicals and you just let the child wander around in there, and lo and behold they swallow some poison and they die. Well, that's grossly negligent. You should have known better. You should have protected the child from those things. This could be ruled a homicide. So homicide could be gross negligence, recklessness, or what you might expect, the intentional action, that the actual desire to cause harm. But it's not always that. It's not always that. Sometimes it's just somebody not doing their due diligence in preventing harm. All right, suicide. This is the intentional and solitary taking of one's life. So if I make a suicide pact with you and I say, oh, well, you know, I'll have this money wired to your bank account if you do this for me, that's legally, I think that would not be defined as suicide, and that person would not get off lightly, I think. So how do we know that it's suicide? We find a dead person. If we know something about their psychiatric history, is this somebody who's been diagnosed with major depression in the past? Is this somebody who's been seeing a psychiatrist and informing them that they have frequent suicidal thoughts? If that's the case and we find them dead in suspicious circumstances, we're more likely to conclude suicide. Now, a person who has been depressed in the past or thought about suicide in the past and is dead didn't definitely kill themselves, but it's certainly a factor that would make us more likely to conclude suicide. If there's a suicide note, and this person has expressed that this is what they're doing and explained their reasons, or you know, that sort of thing, then that would also lead us in this direction, and past attempts as well. And you may think, well, you know, isn't it possible to make it look like a suicide? I shoot somebody, then once they're dead, I walk over and put the gun in their hand. Definitely. So we have to be careful to try to distinguish between suicides, homicides, and accidents. It's not always easy to figure out. Next category, accidental. So in an accidental death, there's no intent to cause harm and no gross negligence on the part of either the perpetrator or the victim. So this means somebody died, but kind of it was really nobody's fault. So first of all, there may be no agent involved at all. I'm walking through the woods and a tree limb falls on me and kills me. Okay, this is not homicide, that's not suicide. This is accidental. There's nobody did anything wrong. Just a tree limb fell on me. Sorry, that's awful. Or maybe there was a person involved, but there was no intention to hurt, and nobody really did anything unreasonable. So for example, I'm driving down the road, and a moose charges into the road, and I try to avoid it, and I turn my wheel suddenly, and I end up hitting a pedestrian on the sidewalk. Well, I didn't mean to hurt you. I didn't mean to kill you with my car, but it happened. and I wasn't acting unreasonably. There's a moose in the middle of the road, and I panic and turn the wheel suddenly. It's not unreasonable that I would do that. So it's not grossly negligent. It's not reckless for me to do that. I am still responsible for your death, but it was an accident. It was an accidental death. Number one cause of accidental death, traffic accidents in the U.S. So wear your seatbelt. Don't drive too fast. Don't drive with people who aren't capable of driving, either because they don't know how to do it, they're intoxicated, or they're distracted. Drug overdoses and drownings are the next two leading causes of accidental deaths in the United States. Next up, we have natural causes. So sometimes people just die of diseases. They have kidney failure, maybe they have a cancer, they have a heart attack, and so forth. That would be ruled a death by natural causes. I've listed old age here. Old age isn't really a cause or manner of death, but it's sort of, colloquially, this is something that this is a term that we sometimes use. It basically just means this person is so old that the wear and tear on their body and the progressive degeneration of the different organs finally has given out. There's either a single or multiple organ failure, and they've died. And so these are things we'd attribute to natural causes. There's nobody involved here. There's no sort of external threat, tree limb falling on me or anything like that. My body just stopped working. Natural causes. Finally, there's undetermined. So undetermined is used when no rational classification can be established. So either there's all kinds of evidence pointing in different directions. So like there's a suicide note, but there's some factors that make me think it maybe wasn't a suicide. And then there's some things that make me think, well, was it accidental? And then I open up the body in the autopsy and I see like, oh, look, it looks like there was a heart attack here. This is really strange. I'm really not sure what to make of this. Maybe I say undetermined. Or maybe we just don't have a clue what has happened here. We find a body. There's no external wounds. There's no trauma. There's toxicology turns up nothing. No poisons, no drugs found in the body. There's no indication of how the person died. That may be an undetermined manner of death. We may just have no idea what happened here. So, in this video, we've talked about how to answer two questions, which is why did the person die, and how did the person die? So why did they die? That's the manner of death, which we've just finished speaking about. What were the circumstances surrounding the death? And how did they die? That's the cause of death. Was it blunt force trauma? Was it sharp force trauma? Was it a gunshot wound, asphyxiation, and so on? So I hope this video has been helpful. Next time, we'll try to answer the question, when did this person die? Establishing the time of death. See you then.